Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, what is a COVID-19? COVID-19 is a large family of virus that can attack human and animal. Well, in human, usual cause respiratory infection ranging from the common cold to serious illness such as MERS and SARS. COVID-19 itself is a new type of coronavirus found in human in the Wuhan area, Hubei, Province, China in 2019. Therefore, this new type of coronavirus is named coronavirus disease 2019, which is abbreviated to COVID-19. How dangerous is this COVID-19? Like other respiratory ailments, COVID-19 can use mild symptoms include cold, sore throat, cough, and fever. About 80% of cases can be returned without the need for special care. About 8 out of every 6 people may suffer from severe pain, such as overcoming pneumonia of difficulty breathing, which usually occurs gradually. Even though the mortality rate of this disease is still low, around 3% for people who are waiting further, and people with pre-existing medical conditions such as diabetes, high blood pressure, and heart disease. They are more prone to becoming ill severe. Looking at development to date, more than 50% of confirmed cases have been cured, and the cure rate will continue to increase. Ladies and gentlemen, what is symptoms of coronavirus? The initial cause of coronavirus infection or COVID can cause flu symptoms. We are fever, runny nose, dry cough, sore throat, and headache. After that, member can be delayed and return. Patient with symptoms that can cope with high fever, cough with phlegm, and even bleeding, difficulty breathing, and chest pain. These symptoms occur when complaining against coronavirus. In general, there are 3 general effects that can include someone who is against the coronavirus, namely is fever or body temperature above 38 degrees Celsius, dry cough, shortness of breath. There are several other symptoms that can also occur during a viral infection: diarrhea, headache, conjunctivitis, loss of ability to taste or smell, rashes on the skin. These COVID-19 symptoms are published with 2 days to 2 weeks after the patient is exposed to the coronavirus. Ladies and gentlemen, cause of coronavirus or COVID-19, it is suspect that that the coronavirus was initially transmitted from animal to human. However, it was later discovered that the coronavirus was also transmitted from human to human. Each can be infected with COVID-19 through a variety of ways, namely 1. Accidentally inhale a splash of saliva or droplets that come out when a person with COVID-19 cough or sneeze. 2. Holding mouth or moving without holding hand. First, after releasing object released by saliva splash of COVID-19. Suffers 3. Close contact with sufferers of COVID-19. Virus treatment. Coronavirus. There is no effective drug to deal with coronavirus infection or COVID-19. Treatment option will be tailored to the patient condition and severity. Some patients with mild or asymptomatic symptoms will be asked to do a self-isolation protocol at home while continue to take steps to transfer the coronavirus. In addition, doctor can also provide several steps to relative symptoms and prevent the spread of COVID-19, namely referring patient with severe COVID-19 for care and quarantine care at a referral hospital. Provide fever and safe medication that is suitable for the patient condition. Return COVID-19 suffers to do independent isolation and adequate rest. Allows sufferers of COVID-19 to drink water for cholesterol level. Ladies and gentlemen, complication of coronavirus. In severe case, coronavirus infection can cause the following complication. 1. Pneumonia or lung infection, secondary infection in other organs, kidney failure, acute cardiac injury, acute respiratory distress and syndrome, and death. For people suspect of being affected by COVID-19 or included in the ODP or monitor person or PDP, patient under surveillance category, there are steps that can be taken so that the coronavirus is not transmitted to others, namely, do independent isolation by staying apart from others for a while. If not possible, use a bedroom and bathroom that is different from those used by others. Do not leave the house except for treatment. If you want to go to the hospital when the symptoms get worse, you should first contact the hospital to pick up. Forbid others to visit you until you are complete health as much as possible. Do not have meeting with people who are sick. Avoid sharing the use of cutlery and drinking equipment, toilet and sleeping equipment with others. Wear a mask and glove when in a public place or with someone else. Use tissue to cover your mouth and nose when coughing or sneezing, then immediately throw the tissue in the trash. Conditions that require direct treatment by a doctor in the hospital, as childbirth, surgery, dialysis, or vaccinating children, need to be treated different with some adjustment during the COVID-19 pandemic. The aim is to prevent transmission of the coronavirus while you are in the hospital. Consult with your doctor about the best course of action that need to be done. Ladies and gentlemen, what you can do to protect yourself by COVID-19. 1. When you're coughing or sneezing, don't forget to close your mouth and nose. Yes, use tissue, handkerchief or elbow phones. 2. Apply physical distance with its distance of at least 1 meter from other people, and don't leave the house if someone needs it. 3. Use a mask when on the move in public place or crowds, including when traveling food. 5. Avoid contact with sufferers of COVID-19. Prefer suspect of possibly losing coronavirus or people who are sick with a fever, cough, or runny nose. 6. Cover your mouth and nose with tissue when coughing or sneezing, then throw the tissue in the trash. 7. Keep clean objects that are often touched and clean environment, including cleaning the house. 9. Routine holding hand with water and soap or hand sanitizer containing at least 60% alcohol more after playing activity outside the home or in public place. Do not touch the eyes, mouth, and nose before washing hands. And don't forget, before eating, after going to the toilet, after handling animal, or after traveling, for wash your hand. And from now, let's wash your hand properly and correctly in order to prevent transmission COVID-19 so that we can protect ourselves and our families from the spread of COVID-19. Take care of your health and see you later. Wassalamualaikum warahmatullahi wabarakatuh.